You need to find different or new ways to do things. Doesn't mean that it will be absolutely something that no one has ever done before, but it can mean that you are applying new thing or what people have even done before in a different way for a community, for a group of people. It's very important.
So welcome everybody. We are in conversation with Isaiah Owolabi today. He is the co-founder and managing director for Hasty Health Initiative, and we'll be talking to him more about his project so far and his experiences and his journey. So please stay tuned. And welcome, Isaiah.
Thank you.
So should we get to the questions?
Sure.
Great. So for starters, please tell us more about Hasty Health Initiative.
It's an organization focused on reducing inequality that limits the ability of women, girls, and young people from living to their full potential. So it's a combination of health and productivity, and also making sure that we're building government systems to effectively accelerate the impact of interventions focused on maternal health, sexual and reproductive health, and economic empowerment.
Right. And when did you exactly come up with the idea of starting this initiative?
So they started October 2007 specifically, and yeah, October 17, 2007 specifically.
And it was you and a group of friends who started this?
Yeah, so it was me with two other people, Paul Ojajin and Rhoda Robinson. And the idea was that we wanted to create three different things, but we felt like collaboration would help us to do more. And by collaborating, we tried to study other entities that were doing similar things. So our goal then was to build an institution that creates lasting impact that would outlive us. So it wasn't about us. It was about the impact that we wanted to create.
Right, right. That's wonderful. And what major problems are you hoping to tackle through Hasty Health Initiative?
So typically, like I mentioned, we focus on health and productivity. What that means is um, there's an intersection between our programming, um, which goes across health and economic empowerment. And we try as much as possible to make sure that we implement program based on need. So our project is usually focused on maternal and sexual and reproductive health, economic empowerment, which means increasing access to finance, and also um, human rights programs that would ensure that we are protecting the rights of our beneficiaries. So, and it's not just a different program. We try as
Right,
much as possible to integrate this into the program. So our health and economic empowerment program are well integrated, for example. So we will work with young girls who would learn coding, for example, or who will learn vocational skills or media skills to amplify their voices on their sexual and reproductive health and rights, or to create information that educate their peers on quality sexual and reproductive health, or even support women with maternal health information that could save their lives. So we kind of find a way to integrate this, and we also support pregnant women or with access to finance because a lot of research has shown that when women have access to
Mm-hmm.
finance, it can improve their health-seeking behavior. So typically, those are the kind of programs that we do from providing birthing kits to pregnant women to making sure that they have access to contraceptives, um,
Right.
both for women and young people, and also ensuring that they have access to training. So our training are focused on what we call the MVT, that's the media, vocational skills, and technology-based skills. So we want to ensure that we're also uh, closing the digital gap, the digital gender gap to women and women, or between women and men. So, because when women have access to many of these resources or opportunities, the chances are high that they will lead a healthy and productive life.
Right, absolutely. So you have something known as the I Care initiative, I Care approach in Haiti. If you could tell us more about that.
So the I care approach is just I care is an abbreviation for or acronym as some people call it for innovation, capacity building, advocacy, research, and education. And this is because for all our program, we first of all try to make sure that they're evidence-based and there's a need for the program. The capacity building component is about the fact that we try to strengthen individual community systems and government and private sector systems to be able to sustain the impact of our programs or our projects. And also, we invest a lot in education, empowering
Mm-hmm.
people with information, especially information that could save their lives. Many times, the difference between a woman that would live and a woman that would die, or a young person that would live to their full potential, or a young person that would not, is the type of information that they have access to and that they have ability to act on. So that's one thing that we also try to do with the education component of
Mm-hmm.
our work, and also the like advocacy. We use the evidence from our work to actually advocate to policymakers, private sector leaders who want to increase investment on health and productivity issues that affect women, girls, and young people, especially vulnerable women and girls and young people, highly disadvantaged women, girls, and young people. We also um, ensure that our program are innovative, but we innovate in a way that we make technology work for people who need it most, because um, there are a lot of technology out there right now that is not working for those who need it most. So, for example, there are many programs that rely heavily on internet to be able to support people in grassroots community. But when the
Mm-hmm.
infrastructure is not there, it's these are expensive projects, but when the infrastructure is not there, it's not useful for the people there. So we
Right.
try to leverage on the most relevant technology for the people that we work with. When we work in urban slums, we make sure that we're using technology that works there. When we work in urban community, peri-urban community, rural area. And also innovation is not just about deploying technology tools, it's about even looking for resources from unlikely places and also connecting the dots between different partners or mapping assets within the community and utilizing that to improve the reach and impact of a project or a program.
Mm-hmm.
Yeah.
Amazing. So, according to you, what can the underserved populations of Nigeria and in the rest of the world, how can they make healthier choices?
Um, for people living in underserved communities or disadvantaged communities, it can be quite challenging for them to make healthy choices. But then um, they can uh, improve their health-seeking behavior by uh, following simple steps that government have put in place for them to be able to live healthy lives. So, for example, though we understand that for many people right now, their reality is, for example, social distancing is impossible for them because of the
Right.
kind of space they live. It's a
Mm-hmm.
packed apartment and they live together. Maybe 20 people might use the same kind of restroom or toilet, and even some don't even have access to proper sanitation and hygiene facility. So it can be quite challenging for some people. But we usually advise is one, to support them based on what they have possible within their local community. So if it means cleaning the facility they have several times, they should. If it means advocating for increased investment, which a lot of them are doing, but using the right evidence, um, they should, or maybe collaborating with an advocacy organization, they should. Maybe the advocacy organization could work better with them to present their evidence to policymakers, especially making policymakers understand that the cost of investing in this is cheaper than the cost of treating these issues, uh, or the cost of uh, maybe responding to it when it has caused huge fatalities. So, and also people in underserved community, well, or in any community, they need to collaborate to be able to map resources and assets within their own communities or competences within their own communities that can help them to improve their health and productivity. There are many ways, many times that these communities can be improved in terms of healthcare and in terms, for example, using long-lasting insecticide-treated nets the right way is important. Or when you have them, you should use them the right way. Um, it's also important that they have a right to their own body. So they should be able to go into a primary health care center to ask for contraceptives and request that the doctor would give them the type of contraceptive that would fit to their own body physiology, for example.
Right.
These kind of things are very, very important. And also, like I said, the quest for knowledge, people need to increase their own knowledge, look for more correct information because there's a lot of misinformation, rumors out there, conspiracy theory out there, and these things are very, very costly to health, to productivity, and even costly to people living to their full potential. So people need to be aware first of their own environment, second of their own body, and also aware of the people around them, which includes their environment anyway, and seek for partnership, collaboration, and unique ways to improve their own health and productivity, especially considering these resources that they have access to.
Mm-hmm. Yes, definitely. Uh, is Hasty Health Initiative doing something different for people in Nigeria during the pandemic?
Well, during the pandemic, our focus has basically been on women,
Mm-hmm.
girls, and basically what we have been doing for pregnant women, especially because we know that they are very, very vulnerable during this
Yes.
time. Apart from the mental stress that the pandemic uh, can give anyone, the fact that resources are also limited within the healthcare system. Most of the resources are focused on responding to COVID-19. Um, so many of them might even go to the hospital and not uh, find doctors also, or many of them also at time during the lockdown, extreme lockdown, uh, couldn't even get to the hospital because there were no transport system and not all of them, in fact, most of them don't have access to their own transportation. So what we started doing was to provide them with PPEs. We supported them with essential medicine. We also support them with nutritious food that would help them to stay healthy and also ensure that we provided a phone number to them to actually speak to a medical practitioner or nurse within their own community. So we consistently did that. And then we also provided for the primary health centers around, supplying them with
Mm-hmm.
PPEs, included face shield, uh, soap, sanitizers, and yeah, just to make sure that when people come here, they are not also stressed out or also contracting the virus when they get to the
Right.
hospital. So we did that. And also for young people, we started educating them a lot about um, preventing sexually transmitted infection and also helping them to have access to contraceptives. The UNFPA estimated that uh, the pandemic will lead to 7 million unintended pregnancy. And if we draw a circle around unintended pregnancy, it could mean a lot. When it's unintended, many times um, it comes into a family that are not prepared, that are not ready. Many of these families do not even have the economic power to take care of the child. It
Mm-hmm.
further distorts their ability to even take care of themselves. And also, what happens is that when you don't take care of a child, the chances are high that the child will not grow up in a healthy way. They might be starved in terms of nutrition. When the child is sick, often it puts a burden on the healthcare system. And even when the child grows up economically, the chances are high that when the child does
Mm-hmm.
not have proper guidance, it's probably involved in some vices, which also put burden on the family, on the system, the society, and it becomes a circle of uh, inconsistent uh, issues, terrible issues,
Mm-hmm. Yes.
and we don't want to create that. So we try to make sure that we are helping young people have access to um, contraceptives, issues related or information on sexual and reproductive health and rights, and also supporting them to also provide information on preventing sexual violence. There was also a lot of sexual violence, or there's also a lot of sexual violence during this pandemic and lockdown, especially. So we are trying to help in that regard, but most of our effort have been on the maternal and sexual and reproductive health. And we also organize training for emerging organizations on mental health during this period
Mm-hmm.
because it's very, very important to be able to make
Yes.
impact, especially long-term impact. You need to be mentally fit to do a lot of things. So uh, those are some of the things that we have been doing during this period.
Wow, Isaiah. It's so amazing to see you all doing this work because you all are tackling such important issues in a place where not everybody thinks of. So thank you so much for the work you're doing. And moving on from Hazy Earth Initiative now and coming to more of your work experience. Uh, you have also worked with the US and Australian government and the Bill and Melinda Gates Institution. So what was that experience like for you and what did you exactly do?
So the U.S. government has supported our work through the U.S. Embassy in Nigeria, and the Australian government too has supported our work through the Australian Embassy in Nigeria. And um, they supported our work on maternal health, also on Code for Impact, which was to train young girls on digital skills, and also on preventing sexual violence. So it was good to have such institutions invest in the kind of work that we do. And it helped us to also accelerate the impact of our work to reach more people, to be able to create systems that would support more women and girls and young people, for example, and to also learn from the models that these people use to monitor and evaluate their work, also internally improving our own work and ensuring that as we have always been transparent and accountable to our partners, our beneficiaries, and all stakeholders around our work. It has also helped our work to expand to 13 states in Nigeria. Also with the Bill and Melinda Gates Institute, um, as a co-founder of the International Youth Alliance for Family Planning, which
Mm-hmm.
I co-founded in 2013. Uh, I served as its executive director for some years and then um, co-executive director also before I exited when I was 30 because it's International Youth Alliance for Family Planning. And the idea is to keep it led by young people and for young people. So the investment of the Bill and Melinda Gates Institute helped to expand our work to over 30 countries across the world and also directly engaging over 1,000 young people as members. And in all of this country, we have country coordinators who are leading advocacy program, awareness program, access on issues related to family planning, contraceptives, you know, across this country, and also empowering young people on different skills, collaboration, partnership building, monitoring and evaluation, project management, many of these skills we've been empowering young people with. So that's technically what that has been over the years.
Mm-hmm. And coming to my last few questions for you, uh, what are some words of advice you would like to give to others who are hoping to join the same field of work as you, say social work or social entrepreneurship?
Yeah, so I always say that it's important to, first of all, have two things or think about two things: character and competence. Um, Character is your passion, your loyalty, your dedication to work, your discipline. That's character. But competence is the skill that you have, which you also have to look for because now, if you don't know it, it's not a challenge. You have someone within your network that knows it. If someone within your network doesn't know it, there's someone within your network that knows someone that knows it. That's the truth. The other thing is that we have access to a lot of online technology, online platforms that can help to build your competence on things like project management, financing, advocacy, research, whatever area that you want to work on. It's very important to acquire such competence so that you do not, your organization doesn't go under within a few years of starting it. One of my friends would say that the mortality rate of youth-led organization is higher than the maternal mortality, even in countries with the highest rate in the world. So, young or old people, or if you want to start an organization, I strongly believe that character and competence are very important. I have added other C's lately, which includes collaboration, because it's important to find um, people, individuals, institutions that you can collaborate with to improve or scale the work of the organization or
Right.
to receive support or to get referrals from them. Collaboration is very important. Some collaboration are complementary in the fact that you are providing this service, they are providing the other service, you are providing healthcare for women, you are providing financial services. And you could organize a program together where women know that they have access to both health information or antenatal care, and also economic empowerment. So, it's, or maybe your families will have access to some. So collaborations can give birth to a lot of things. It can give birth to training your own staff, training your own people, and also collaboration would mean you working with people to build a team that believes in your vision, which is very, very important. The other thing is creativity. Uh, our world is really evolving very fast, especially with technology and a lot of things. It's important to be creative. Cannot do the same thing the same way and expect different results. That's a common saying. So you need to find different or new ways to do things. It doesn't mean that it will be absolutely something that no one has ever done before, but it
Mm-hmm.
can mean that you are applying new thing or what people have even done before in a different way for a community, for a group of people. It's very important to note all of these things so that people can build an organization that is creating systemic change, is able to scale, and can also um, be sustainable. So I always think about these three S for myself, which is systems, scaling, and sustainability. I think
Mm-hmm.
every person who is trying to create an organization, and the 12 years or 13 years now that we started AC, this has been the key thing that I would say I take away from what we do. It is systems, scaling, and sustainability.
Sustainable.
Those
Yeah.
three S is very, very important to any work that uh, you're doing as an individual. And that institutional mindset, long-term impact is very important. Clarity of goals, those things are very important because that's how you can define a path that you want to go and how you technically want to achieve it. And also,
Mm-hmm.
um, a lot of new organizations are quick to implement program or projects, but they are not collecting enough data or documenting enough to be able to inform decision making within their own organization or learnings or to be able to share learning within an organization. It's also important to document whatever you're doing or to be able to collect data from what you're doing so that it can inform future interventions or even to be able to share knowledge with other partners who are doing similar work that you are doing, or even when you want to raise funds, it's easy for you to pitch that this is what we did with 70 people, this is what we discovered. We know if we do with 500 people, this is what will happen because we have seen this great result just doing it for 70 people. Oh, this is what we are hoping to tweak in this new phase of the project. And this is why we are hoping to do that. That's what data, that's what documentation can give you. And also it can help you to show people the value in what you are doing.
Right. That is, you said that really, really well, and I hope this reaches the right people, and I hope this inspires them to start something of their own as well, and make the world a better place. And
Yeah.
finally, before we leave, if you could just let our listeners know about how can they get in touch with you and know more about your work, or how they can support your initiative.
So we are on Instagram, Facebook, Twitter as at AC Health. That's HACEYHEALTH, AC Health Initiative.
Mm-hmm.
AC Health, that's what we are on Instagram and Twitter, and on Facebook, AC Health Initiative. And our website is www.hacey.org. There are a lot of opportunities to volunteer on our website. So either you're in Nigeria or not, either you're a data scientist, a computer programmer, a writer, a journalist. There's so many things you can do for us. You can help us, you can write content for us, you can review content for us, you can design graphics for us, you can volunteer to mentor or teach uh, uh, young girls who are benefiting from our coding or career development program. There's so many things that you can technically do for us if you go to our website and you register on our volunteer page. And yeah, and you could also donate to our work. Check the donation uh, platform on our website. So these are things that you could do to accelerate the impact of our work and making sure that we are able to improve the health, productivity of women, girls, and young people who need it most.
Lovely. Thank you so much, Isaiah, for joining us again and being so patient throughout this process. Uh, Listening to you and talking to you has been really inspiring and really great. So, thank you again for joining us.
Thank you so much for having me.